Massage the face, waxing, everything. So God bless you and we love you so much. Asante. Hapo kwa waxing ni ukweli. Thank you.
Thank you so much. And now let's stand as we welcome waziri wetu. Tumpigie makofi. Karibu sana waziri. Thank you, karibu.
Tukae chini. Thank you very much. The woman of the moment boasted herself, Madam Dama. Na wageni wote hamjambo. Bwana asifiwe. Yangu ni kuja hapa to wish you a very happy birthday, Dama. And I want to assure you that sio ati tulikuwa hatuna pahali ya kwenda. It's because you are a very important person in our life. Na kwa siku ya muhimu kama ya leo, tukaonelea ni vizuri tukuja hapa and we join you in your special day. And I know how you are feeling because it is exactly how I felt when I was your age, when I was 21 years old. So I know it's a special feeling. Nitaka kusema tu mambo matatu. Watu wetu, kwanza tupendane. Kila mtu apende mwingine. It is very important we love each other. Second message, let's keep the focus. Whatever you do, ndukanate focus. Oria wekaga. We mwaka kana we muru, ndukanate focus. Na kitu ya tatu, na ndio nimekuja hapa Dama. Niga na meha mai miregeshagi mayoka gwetha wira na Nairobi. Waya goko. Niga na mokire wira na Nairobi. Ni ndio kire wira. Goko ti mugutire wira mwokire. Wira ria mwingi mwatigire icagi kuria kwa nyuma thioya. Wa kwenja feji. Ucia kahwa. Utua macani. Goko mwokire gwika atia? Gwetha mbeca neguo. Ku aikoro hae mundu wokire gwetha wira. Acoka ki? Kuni ko wira ukirite. No aikoro we haha. We example ya Dama. No thio wetha ki? Nando ito maundu maya mothe meguku thi. Ona mangithi mahane atia? Ithuĩ kwanja muno andu aruge ondraria. Kirega tigara thirikari no yuke na yure ite no cioke na ciure. Kirega tigara nikio gitu na wethi witu. That is why Dama and all the investors who are here, I'm very proud of you. Murage na cioke. Mutikariganirwo andu itu. Kaundu karia tutangitunywo ni mundu wothe nikio gitu na gwetha indo. Ndikwenda ukiria hau. Happy birthday Dama. Ni hakwa ndaigo aheo this and that. Hakwa, your next visit to the children home will be all on my cost. Yeah. Hayo kikwetu ndamenya. Icio kicio the winacio. No ndamenya ngoro ya guteithania na guteithia andu na kunyitirira aria matari na kiene. Ni hakwa no ngurire uthandweke kabara ngumubange tugathie. Na mutumia oni angenia muno mutumia gwitwo Mama Boaz. Na nini ona gutuka donataburo muno. Ni tundaigua Dama kurire ni ukuona mundu. Ni ndakwendera papasi mufeje. Ni ro aiko kiure kire Dama. Mwanake ndakora thimbira gaitwa murathime wawe. Asante sana.
All right. Wapi makofi mazuri ya waziri? Thank you. Amazing. Hey. Niona mundu. Ndio gibindi kiu urambia mafeje. Gibindi kiu urambia ndio director. Director nionekana ihenya. One more time, can we appreciate Waziri for us? Head very important. Then atuthie tha ici ihenya tutanaria keki. No, before that, nikwenda ku recognize aruti all the adama rogama.
Welcome, CS Moses Kuria.
To the family of Mzee Muriuki, my sister Mary, mami na familia yote, waziri wetu wa afya, PSs wote ambao wako hapa, Mheshimiwa Pato kutoka kwa kamati ya bunge na watu hapa Geshogo, hamjambo? Muriega rege Ngai ni mwega na hĩndĩ ciothe tũgeithanie ciarĩra-inĩ. Asante sana. Nimekuja hapa kushirikiana na dadangu PS Mary na kuleta rambirambi zangu na familia yangu kwa sababu ya kuachwa na mzee. Mehesabu hiyo miaka mzee amekuwa hapa, kaona imegonga 90. Hata kama tuko na majonzi, tushukuru Mungu pia, kwa sababu alitupatia mzee bila deni, bila title, akatupatia tu bure. Na hiyo ni deni alitukopeshea na hata haikuwa na interest. Mimi kwangu nikifikisha 80, hata hiyo 10 hata wacha ikae. Ni baraka kabisa. Karatigu ya doitu. Miaka miloko kenda ni minini. Ni kirathimo. Na niseme Mary ujipe nguvu na tumuruhusu mzee apumzike. Mary ni rafiki yangu, tulijuana hata kabla akuwe PS, sababu ya ile kazi alikuwa anafanya hapa upande wa Chamber of Commerce. Na kama kuna mtu najua amefika pahali amefika kwa sababu ya bidii, ni huyu Mary. Huyu adrama toi kuhoto nitaki ni toyo PS. Na sisi tuko na, we are very proud of her. We are very proud of her as a country and as a government. Na najua mmesikiza risala ya rais, na Maria pia rais amenipigia nikuja hapa, anasema hata katika hii mpango ametumana watu yake wako hapa na 500,000 shillings ya kusupport mipango ambayo tuko nayo katika siku ya leo. Pia niseme sababu ya ile kazi Maria anafanya huko katika wizara, na tuko na wizara yote hapa, waziri tuko hapa na PSs wote. Jameni, mradi mimi ningetaka kuomba zote tuunge mkono. Tumehangaika sana na mambo ya afya. Na unajua jambo lote mzuri lazima likue mwanzo liko na matatizo. Na mimi najua tukifika Januari, hii matatizo kidogo kidogo tunaongea mambo ya afya, tutakuwa tunaongea story nyingine. Hapa katika kaunti ya Kirinyaga tuko na facilities, health centers, mahospitali 70. Katika hizo mahospitali 70 hakuna hospitali hata moja. Kama kuna hospitali haina stima, PS wetu wa energy ako na hiyo program, anaweka stima katika mahospitali zote. Idara yetu ya ICT, hizo hospitali 70 hakuna hospitali hata moja ambao haitawekwa internet. Na sio internet ya kawaida, ni ile tunaita 5G fiber. Kwa hivyo hata maneno ya afya kando, hii mradi itaacha kaunti ya Kirinyaga ikiwa mbele sana, upande wa stima, upande wa internet. Na Maria, ningetaka tuangalie hiyo internet, hata wale watu wako hapo kijiji pia watumie bure. Kana nete ya doito etu uoneke ya mwana neka hatia ni wataka kana yitu kwa doito. Mwisho nikimalizia niseme sisi na ngoda kwalia na lugha ya huko kwetu. Ndimoleria huko kwetu Kirinyaga. Kaide mwere andu aitu. Muthomi mogi akayo mitho na ki. Na ndimwire ndirekire mathabu. Hahe na andu a muthoni ndikana na madagitari tuna ciezi ha mathomeire dagitari. Ni biology to ni wathomagira udagitari ndanyitaga i. No mathabu ri ndanyitaga i. Koguo horo wa mathabu ni njui. Na ndathire gika mathabu nginya university. Koguo he undu njui wa mathabu. Mathabu maya ndina mundeka ri. Maranyonia ithuĩ nyũmba ĩno itũ gũkũ tũrĩ. Andũ aya angĩ othe a Kenya mangĩnyitana. Ũnene mũrĩ wonagĩra kĩa ngwacĩ. Hau nĩho mũgũkorwo mũkuhĩrĩirio nene biũ. Kũrĩa mbunge na nĩmuronire nginya kura cigĩikio. Ona andũ othe a kĩrĩma mangiuga patũ atĩ mũikie kura kando. Cianyu citiganĩte ona thaburi ĩmwe. No gũkũ tũtiratũkiuga tũrĩ aingĩ. Andũ aitũ rorai nginya tũmĩgũnda kũrĩa gwitũ Kiambu. Mũndũ wĩna nginya nuthu ĩka thikũ ici thutha wa kũgaĩra ciana aretwo andũ aretwo land grab atĩ arĩa moire mĩgũnda ĩrĩa mĩnene tondũ tũtirĩ na nginya mĩgũnda. Andũ aitũ nĩ andũ a biacara me kũndũ guothe. Nyũmba ĩno itũ tũngĩremwo nĩ gũikara na andũ arĩa angĩ bũrũri wa Kenya. Tũrinaga rwĩmbo rũrĩa wĩragwo mwathani wakwa njakanĩria tawa. Nyumĩtwo thutha nĩkĩ? Mũthomi mũũgĩ aikagia maitho na kĩ? Nĩwe mũndũ ũngĩugaga Mangai ngũkahũra. Ũcio waiga nĩ ũkũhũra ũreciria nĩ muohe moko na thutha. Atongoria aitũ meke mathabu ma kũhĩtũka ti mathabu ma kũgwa. Na tũmenye tũrĩ atongoria tũhana ndereba ĩna bathi ĩhũrĩte andũ nginya magacuhĩrĩra. Tũtigeke maũndũ nĩ ũndũ wa ithuĩ enyewe tũcoke andũ aya tũmatware irima-inĩ. Mũndũ eka mathabu. Nĩ kwĩ andũ mathiaga nĩ ndahonokire ndikĩnyuaga no rĩrĩa ndanyuaga ndathiaga mbaa. Na he andũ mathiaga magacokotha. Ũgeciria ũyũ ũracokotha ma arĩrũa mbara yaima tũkahũrwo tũkamũria we ũgũcokothaga tuga ndũrĩ mũrũi. Andũ aitũ tũtigacokere mahĩtia rĩngĩ. Tũtigacokere mahĩtia rĩngĩ. Tũthime wega. Niĩ njugaga ona mũtumia gũtirĩ mũtumia ũraga hĩndĩ ya magetha. Ciake cigethwo nĩ mũndũ ũrĩa ũngĩ. Kana tiguo ya atumia. We no ũrĩa ũtige mbembe gwaku mũgũnda ciũke cigethwo nĩ ũngĩ. Kũu tiguo kĩega. Ngai tũmũrathime na mwĩke wega. Asante sana.
The assurance I'm giving the public is basically one, that once the system stabilizes, they will receive their services without any interruption. Two, I also want to assure the public that they are going to get more benefits as opposed to what they are getting under the National Health Insurance Fund. The most important thing is every citizen who has registered can access free medical cover at level 2 and level 3. So our nation is going to have a healthy population because they will be able to access the healthcare. And as we go along, as we contribute as a nation, the huge disease burden that we were facing is going to be a thing of the past because the government has taken care of the chronic and critical illness funds to support those who are in need of support in terms of critical care. But the most important thing also that needs to be understood by the public is that for the first time since our Constitution 2010, that we are going to provide for emergency care, as provided for in Article 43 of our Constitution, subsection 2, that every citizen is entitled to emergency care. I want to assure the nation that as long as we continue contributing to our social health insurance fund, we are going to offer quality care and also affordable care to the citizens. Our enrollment has been quite successful. We have enrolled 12,800,000 members, 8 million being, most of them being members of the previous NHIF, and then about 4.5 million being members that were newly registered. As we are approaching the first, we saw a lot of people registering. The number went up. There was a lot of push for registration, you remember. And right now, the registration is stagnating. It's not moving up the way we expected. So what we have agreed is that as a result of this meeting, we are also going to work with the counties to increase the enrollment. We also realize that as people are registering, some of them at that particular time are not adding their dependents. So we have agreed here today that together with the counties, now we are going to do sensitization where we have the members who have registered and they have not added their dependents. So we are going to come up with a manual that will be given to the CHPs, it will be given to hospital staff that are working there when a patient comes and they realize that they have not onboarded their members, their staff, their dependents, they can quickly do that. But the key thing is to do early sensitization so that most of them onboard their dependents. So we have agreed on a strategy of how to do that, which will commence next week. The NHIF Act could not accommodate the rollout of universal health care. And therefore, we passed the 4 laws that will support, which was the legal framework that will support the rollout of the universal health care coverage. And therefore, we had to come up with a clear roadmap of now moving from the NHIF to the Social Health Authority. The key thing also that we looked at is we have now 3 funds as opposed to the earlier NHIF where there was only 1 fund, which was the contributory fund. But now under Social Health Authority we have 3 funds. That's the Primary Healthcare Fund, which will cater for treatment of patients at level 2 and level 3 facilities. And this will be provided free to those who are registered under SHA. And then the second fund is the Social Health Insurance Fund, which is a contributory fund for all Kenyans who have registered and have either they are salaried or they are unemployed. If they are unemployed, then they have to be verified through what's called the means testing or assessment of their income based on their status, and they will be the assessment will be done, and they will know exactly how much they are supposed to pay in terms of their contributions, which will be 2.75%. Those who are salaried will definitely, from this month, the employers are going to deduct their 2.75% from their gross salary to be paid to SHA on the 9th of November. So the shift is basically because we have 3 funds. I have talked about the 2 funds. The other fund is the Emergency Chronic and Critical Illness Fund, which will be funded through the Exchequer. So you realize that under this new funding model, we have 2 funds that are catered for by the national government. That is the Primary Healthcare Fund and the Emergency Chronic and Critical Illness Fund that is appropriated and budgeted for through the National Assembly. But the middle fund, which is Social Health Insurance Fund, is what is member contribution. So there is definitely need to shift from the NHIF to the Social Health Authority. the national government requested NHIF to provide enhanced medical cover for the civil servants. And similarly, the county governments also requested NHIF to provide enhanced cover for their employees. Under the social health insurance, now there is no enhanced cover anymore. We are all entitled to one cover, one benefit, one tariff for all the services. And that's why the county governments now, as an employer, have to look for an alternative private insurance to provide for the enhanced cover that they were giving to their employees. Similarly, the national government is also in the same process. The challenge that they have been facing is that the period that the notice that we gave them was too short a notice, and they requested for extension. We have since then extended for the national civil servants up to the 21st of November, when NHIF will cease providing any service. So currently, they'll get the enhanced service, but we expect that by the 21st of November, there will be a solution that the national government and the county governments will have gotten. Some of the county governments have already engaged some of the private insurance firms to cover for their employees. It does not mean that now they have been told to go and look for cover elsewhere. They are entitled to their social health insurance funds, and we expect that when they go to the facilities, they will present themselves and they will be treated. If there is anything extra over and above what is not covered under SHA, then they can use their private insurance, which is provided for by the employer, that's the county government. Today, we requested the county CEC's caucus, that is the top leadership of the CEC of health within the 47 counties. We had an early engagement with them, the entire CEC in Mombasa, where we took them through the shift from National Health Insurance Fund, that's NHIF, to the Social Health Insurance Fund. We've also worked with them very closely during the rollout from the 1st of October, and therefore we felt that it was important that we have an engagement with the CEC caucus to review the performance and the challenges that the system is facing, the challenges that we are facing in terms of implementation of the Social Health Authority. Indeed, it has been a very successful discussion. We've received a lot of feedback, and from this feedback, we are going to now come up with an action plan where between the national government, Social Health Authority, and the counties, we are going to form a team that will be able to spearhead this rollout across the 47 counties. So every county will have a team, a multi-sectoral team that will be able to support the rollout. We've agreed that this multi-sectoral team will also include other government agencies like the National Government Administrative Service or officers, whom will also play a key role. You are aware that we also, as a ministry and the Social Health Authority, we called all the deputy county commissioners at the KSG, where we took them through, and under the leadership of the regional commissioners, they now took up the responsibility of going to support the rollout. Counties have also accepted that we adopt the same structure, and now we bring all the agencies together. That's a very key outcome of this workshop today.
Until someone, and someone is unwell. So we need to emphasize the mission of SHA, because we would like equity. Yesterday, because we are very bad, but because we have something to offer. So when you see people attacking us, I think it's only fair. I mean, as soon as it's possible. Second, there is of every other issue. So Now it is sorted, you have what declaration are we waiting for? Why can't we just make the people go to www, get help from someone who has a smartphone, do it from there, so that we complete.
There's some change that was done, so that you...
and other government bodies. So SHA is them down to a situation where now, as the users, have to be, when you go there, you need to do the following. And that is. And the vision is to make sure that all these people who invade our WhatsApp groups for Harambes are not there, because SHA will pay all these hospital bills. That is very